This
Okay.
is Art. I live in Weston, Massachusetts, and my story begins probably about a year ago, where I had a back problem where I was getting a lot of pain in my lower back when I walked and I climbed stairs. Previous years, I've had a stenosis operation on my lower back, which my current situation back a year ago was a very different cause. What I had, according to the two surgeons that I saw at the time, was effectively 6 or 7 broken facets. And the first surgeon who had operated on me previously for the stenosis refused to touch me for this. He said, "You got 3 potential outcomes if I do anything with you on the operating table. 1 is you'll get better. 2 is you'll stay the same. Or 3, you'll be worse. So, can't help you. Go find the pain management source." Then I went to another surgeon for a second opinion, and he didn't quite give me those 3 options. He said, "I can help you, but I'm warning you that you're going to have a lot of nuts, bolts, and screws in your back and everything that goes along with it." I said, "Yikes, this doesn't make good sense to me." So what I decided to do is talk to my primary care. And in talking to my primary care, he suggested pain management, specifically with Dr. Pearl in Framingham, who I knew nothing about. So anyway, I went out to see Dr. Pearl. She analyzed my x-rays, etc., CAT scans, and basically came up with the conclusion that a stem cell transplant would be helpful to me. The environment there is non-threatening at all. It's very friendly, very positive. It's a new, clean office, large office, in an office building. It's not a hospital environment per se, but they do have I want to call it an operations room, or it's more of a procedure facility than anything else. And there is no anxiety at all on my part. I mean, it looks safe, clean. So I went ahead and she started the procedure. It's a 2-step procedure. One is taking the stem cells out of you, processing them, and then putting them back into your back in the locations of these 6 or so areas which need to be rebuilt by the stem cells. And I would say 2 weeks after that, I was already feeling better. I wasn't totally better, but I was feeling much better, much less pain. And within another 2 weeks, when it was time for me to go back and have the second part of the procedure, which is the replacement of the platelets, which is a much easier and simpler procedure. But again, all of this is totally pain-free. By that time, I was virtually totally pain-free and was able to walk, I would say, without any trouble, a mile or so. And by the way, my next objective is to try a walk of about 2 miles. I haven't quite tried that yet for other reasons, nothing to do with the back, other medical issues. 2 months ago, stem cell procedure, and about 4 weeks ago, I went through the platelet. Throughout this period of time, Dr. Pearl, who's a very nice lady and very understanding and very patient-oriented, had me do physical therapy with a group called ATI out of Framingham. And I must say, kudos to them. They were just terrific in every way. And I'm still going right now once a week. And they do a great job. It's non-invasive in any way. And again, pain-free. And from their standpoint, the perfect complement in temperament and approach to Dr. Pearl and her staff. My back situation right now is I'm in pretty good shape. I go to the beach in the summertime. So I just tried walking on the sand, which going back to July or so, it was impossible for me to walk on the sand because of the unevenness. Same thing with any grass. Could not walk on the grass without some difficulty and pain. Now, I've tried both recently, I'd say within the last 10 days. I've got it, man. I can do it all. So my next step, as I said, is to see what the 2-mile walk